Welcome back to Restoring British Health, the investigative podcast that pulls apart what's really in our food, our water, and our supply chain. In the last episode, we looked at Britain's rivers, every single one of them contaminated. Sewage, pharmaceuticals, synthetic hormones, agricultural chemicals, PFAS, the lot. At the end of that episode, I said something that I think a lot of you have been thinking about since. Those rivers are where your drinking water comes from. So in this episode, we're going to follow that water from the river, through the treatment works, through the pipes, and into your kitchen tap. I need to warn you now, what we found is not what the industry wants you to hear. The Drinking Water Inspectorate will tell you that English tap water achieves 99.97% compliance with regulatory standards. 99.97%. That number gets repeated so often by the water industry, it's become a kind of mantra, an incantation if you will, a number designed to close down questions, not to invite them. But compliance with the standard is only as meaningful as the standard itself. When you look at what British drinking water regulations actually require, what they test for, what they ignore, what limits they set, and how those limits compare with the rest of the developed world, a very different picture emerges. May 2024, a seaside town called Brixham in Devon. Cryptosporidium, a waterborne parasite that causes severe diarrhea, vomiting, and stomach cramps. It was found in the water supply serving around 16,000 homes and businesses. What happened? A damaged air valve in a pipe running through a field where cattle grazed. That was enough. The organism got into the network. South West Water initially told the customers the water was safe. It was not. By the time a boil water notice was issued, over 100 people had already reported symptoms. That notice stayed in place for 8 weeks for some households. At least 100 confirmed cases of cryptosporidiosis. People hospitalized, including a 13-year-old boy. A primary school forced to close because it couldn't operate without safe drinking water. Cars queued for over half a mile at bottled water collection points. Businesses said the outbreak had destroyed their trade. And here's the thing. The Drinking Water Inspectorate's own report acknowledged that South West Water had known about leaking dosing lines at their treatment works since at least January of 2024. They'd known for months and they did nothing. South West Water's parent company, Pennon, reported the incident cost them nearly £40 million. In that same financial year, the company's underlying profits rose by 8.6% to £166.3 million. Shareholders got a 3.8% increase in their dividend, and the CEO's pay package rose 58% to £860,000. A town poisoned, a CEO rewarded. And Brixham was not an anomaly. In 2024 alone, the Drinking Water Inspectorate was notified of 556 water quality events across England. Anglian Water was fined a record £1.42 million for drinking water failures, affecting approximately 1.3 million people. They'd repeatedly introduced unapproved materials into the water supply. At one Southern Water Treatment Works, UV disinfection systems designed specifically to kill cryptosporidium suffered outages on 22 separate occasions in just 6 months. At another works, Thames Water detected E. coli in treated drinking water during heavy rainfall. The 99.9% compliance figure comes from nearly 4 million tests, but those tests only catch what they're designed to catch. When the system fails, as it did in Brixham, entire communities discover that the infrastructure between contaminated river water and their kitchen tap is considerably more fragile than they were led to believe. Now let's talk about lead. Lead pipes were common in Britain before 1970. They were subsequently banned. But here's what nobody did. Nobody replaced the pipes. The result? An estimated 40% of properties in England and Wales, roughly 8 million homes, are still connected to lead plumbing in some part of their supply network. 8 billion homes. Lead is a cumulative neurotoxin. The World Health Organization has declared there is no safe level of lead in drinking water. None. In children, lead exposure impairs mental development. It contributes to behavioral problems and it damages cognitive function. In adults, it's been linked to kidney disease, cardiovascular problems, and reproductive harm. These are not disputed findings. This is the scientific consensus of every major public health body in the world. In 2024, the Drinking Water Inspectorate recorded 53 compliance failures for lead. It also contributed to 54 water quality events. At one care home, an inspection revealed that a plumber had illegally used lead solder on the fittings, a practice banned on cold water systems. But you can still walk into any plumbing shop or DIY shop and buy lead solder off the shelf. At schools tested in 2023, some tap water samples exceeded the legal limit of 10 micrograms per litre. Children drinking water at school that exceeded the legal lead limit. And the legal limit itself, it's under scrutiny. A December 2024 advisory group recommended tightening the lead limit to 5 micrograms per litre. This brings it in line with the EU's revised Drinking Water Directive. As of now, that recommendation has not been turned into law. The EU deadline for member states to adopt this standard was January of this year. Britain, having left the EU, faces no such deadline. The water company's collective ambition is to be, quote, lead pipe free by 2050. 2050, that's a quarter of a century away. For pipes that were banned over 50 years ago. In the meantime, do you know what they do? They add a chemical called orthophosphate to the water supply. It forms a coating inside the lead pipes to reduce the amount of lead dissolving into your drinking water. And that's the solution. Coat the inside of the poisonous pipe with chemicals. The Drinking Water Inspectorate's own advice to homeowners with lead pipes includes running the tap for at least a minute every morning to flush standing water. Never using hot water from the tap for drinking or cooking because hot water dissolves lead more quickly, and flushing for 10 minutes after any plumbing work. This is the official guidance from the regulator of one of the world's wealthiest nations. Run the water and hope for the best. Now PFAS, the forever chemicals. We covered these in the last episode when we looked at the rivers. More than a third of watercourses tested in England and Wales contain PFAS at medium or high risk levels. The River Thames has the highest PFAS concentrations in the country. A site in Glasgow recorded the second highest concentration of one PFAS compound ever found in surface water globally. Those rivers supply the treatment works that produce your drinking water. So the critical question is, how much of that contamination survives treatment and reaches the tap? In 2024, water companies carried out over 770,000 analyses for individual PFAS in England. 96% of samples fell below the detection limit. No treated water was reported in the highest risk categories. Sounds reassuring, right? But the standard itself is the problem. Britain's cumulative limit from 48 monitored PFAS is 100 nanograms per litre. The United States has set an enforceable limit of 4 nanograms per litre for the two most common PFAS compounds. Britain's threshold is 25 times more lenient than America's for the same chemicals. There are more than 10,000 known PFAS compounds. On top of that, Britain monitors for only 48 of them. And here's what really needs to sink in. There is no statutory legal limit for PFAS in English and Welsh drinking water. None. What exists is Drinking Water Inspectorate guidance. Guidance, not law. In November of 2024, Liberal Democrat MP Munira Wilson introduced draft legislation to require statutory PFAS limits. She told Parliament that there is currently no legal limit on the amount of PFAS in British drinking water, and that the River Thames in her constituency recorded PFAS concentrations 11 times above the EU's safe level. As of late, the government has not legislated any of this into statute. Meanwhile, a YouGov survey found 77% of British adults believe PFAS present a significant risk to human health, and 88% believe their use should be stopped or subjected to more effective controls. PFAS do not break down. They accumulate in human tissue across a lifetime and across generations. They've been detected in breast milk. They're linked to testicular cancer, thyroid disease, increased cholesterol, liver damage, fertility problems, reduced sperm quality, and developmental complications in unborn children. Britain's drinking water limits for these compounds, they're not law, they're not enforceable, and they are 25 times more permissive than those of the United States. Now, this section might be the most unsettling of the lot. The tap water that enters British homes is not routinely tested for pharmaceutical compounds, and that is not an oversight. It is by design. Drinking water treatment plants were never built to remove pharmaceuticals, and the regulatory framework does not require them to. As we covered in the last episode, British rivers contain a cocktail of antidepressants, antibiotics, painkillers, anti-inflammatory drugs, hormonal contraceptives, and stimulants. These substances enter waterways through human excretion. When you take a prescription medication, a significant proportion of the active ingredient passes through your body and into the sewage system. Wastewater treatment does not eliminate them. They then flow into the rivers. Those rivers supply drinking water treatment works, and conventional drinking water treatment, chlorination, filtration, coagulation, was not designed to intercept these molecules. In the UK, 2 widely prescribed antidepressants have been detected in finished drinking water at measurable concentrations. Now, the concern is not that a single glass of tap water will give you a meaningful dose of antidepressant. The concern is chronic, cumulative, low-level exposure over decades to a mixture of pharmaceutical compounds whose combined effects have never been studied. As one environmental chemist put it, if you drank 2 liters of water a day for 70 years, you'd have consumed roughly 1% of the normal daily dose of any individual medication found in those trace amounts. But the impact of chronic exposure to a mixture of drugs simultaneously, that is a question science does not yet have the answer to. But what science does know is that these pharmaceutical concentrations are sufficient to feminize male fish, alter their behavior, and collapse localized populations. If the dose is biologically significant for aquatic life, the assumption that it is biologically irrelevant for human health deserves considerably more scrutiny than it currently receives. A systematic review published in 2024 looked at studies from around the world. The average concentration of microplastics in tap water? Approximately 57 particles per litre. Microplastics, fragments of synthetic polymer smaller than 5 millimeters. They are now found in tap water, bottled water, and beverages globally. They enter drinking water from the degradation of plastic wastes in rivers, from wastewater effluent, and from the water distribution network itself, including the very pipes that carry treated water to your home. Microplastics smaller than 10 micrometers can cross cell membranes and enter your body's systems. Nanoplastics, those smaller than 1 micrometer, can cross the blood-brain barrier. A 2024 study published in the New England Journal of Medicine found microplastics and nanoplastics in human arterial plaque. Their presence was associated with increased cardiovascular risk. The World Health Organization has called for more research and a crackdown on plastic pollution, but they acknowledge that definitive evidence of harm from microplastics in drinking water has not yet been established. The EU has added microplastics to its watch list of emerging compounds. The UK has no standard, no monitoring requirement, nothing. And here's a detail that should make you think. The drinking water distribution network itself can be a secondary source. Microplastic concentrations measured in pipe scale and debris range from 679 to 45 million particles per kilogram. The pipes delivering your water are shedding plastic into the water they carry. This one is particularly frustrating because it's the treatment itself that creates the problem. Chlorine, the chemical added to tap water to kill bacteria. When chlorine reacts with natural organic matter in the water, it creates disinfection byproducts. The most notable of these are called trihalomethanes. Trihalomethanes are classified as conditionally carcinogenic. Long-term exposure has been associated with an increased risk of bladder and colorectal cancer. Research at Birmingham University found links between the chemicals formed during chlorination and specific birth defects, including cleft palate and hole-in-the-heart defects. And here's the kicker. Climate change is projected to make this worse. Rising water temperatures and increasing dissolved organic carbon in surface water, both consequences of warming, drive higher byproduct formation during chlorination. Scottish Water has already had to invest in treatment upgrades to manage trihalomethane levels. A December 2024 advisory group proposed new limits for haloacetic acids, another family of disinfection byproducts, going beyond EU requirements. New limits for chlorate, chlorite, and uranium were also recommended. As of now, none of these recommendations have been turned into law. Even after treatment, even after all of that, there's one more problem. England and Wales lose approximately 20% of treated drinking water to leakage. 1/5 of all the water that has been cleaned, treated, and disinfected never reaches a customer. The industry target is to reduce this to 17% by 2030, still significantly above the EU's benchmark of 15%. But leakage isn't just wasteful. It creates pathways for contamination. When water pressure drops, during burst mains, power failures, or supply interruptions, contaminants from the surrounding soil can be drawn into the pipe network through cracks and joints. The Brixham cryptosporidium outbreak was caused by precisely this kind of failure. In December of 2024, a significant water quality event at Southern Water's Testwood treatment works caused a loss of supply to over 130,000 consumers. In a separate incident, over 700 consumers lost supply for 6 days when a raw water main burst near a reservoir in Sussex. The infrastructure carrying drinking water to British homes includes pipes that have been in the ground since the Victorian era. The system is aging, it is underfunded, and it is operated by companies that have paid out £78 billion in dividends while accumulating £64 billion in debt. Every leak, every burst, every pressure drop is an invitation for the contaminated groundwater, sewage, and agricultural chemicals we documented in the last episode to find their way into the network that carries the drinking water to your home, your hospital, and your child's school. Now, I'd like you to think about something that most people don't consider. You might buy a water filter for your kitchen tap, and that's a sensible thing to do. It will remove some chlorine, some lead, some particulates, but it will not protect you from the same water when it arrives in your food. Water is the first or second ingredient by volume in the majority of products sold in a British supermarket. Think about that. It's the base of every soft drink, every carton of juice made from concentrate. It is the liquid in every tin of soup, every jar of sauce, every ready meal. It is used to wash and process every bag of salad, every prepared vegetable, every piece of fruit in a sealed plastic tray. It is the medium in which meat is brined, poultry is glazed, and fish is chilled. It's present in bread, in beer, in confectionery, in baby formula. Virtually no processed food or drink product reaches a British consumer without having tap water being used at some stage in its manufacture, preparation, or packaging. And that water comes from the same main supply we've been talking about. It meets the same 99.97% compliance standard. It is subject to the same regulatory gaps. It carries the same contaminants at the same concentrations. There is no separate higher standard of water purity for food production. The PFAS that have no statutory legal limit in your tap water, they're not tested for in the water used to bake your bread, wash your lettuce, or fill your child's carton of squash. The pharmaceutical residues that treatment plants were never designed to remove, they are present in the water that is boiled into your stock cubes, mixed into your sauces, and frozen into your ice cream. The microplastics averaging 57 particles per litre that no monitoring standard addresses, they are in every litre of water that enters a food factory. A person who installs a reverse osmosis filter in their kitchen and never drinks unfiltered tap water is still consuming that water in concentrated or even diluted form in virtually everything they eat and drink that they did not grow, prepare, and cook themselves from raw ingredients using filtered water. The filter protects one glass. The food supply uses millions of litres of the same unfiltered water every day, and no filter stands between the treatment works and the factory. This is the point that the 99.9% compliance figure obscures most effectively. The question is not just what's in your tap. The question is what is in everything that your tap water was used to make. So let me ask these questions directly, and I want you to think about who should be answering them. Why does Britain have no statutory legal limit for PFAS in drinking water when the United States has enforceable limits since 2024? Why are 8 million homes still connected to lead pipes more than 50 years after their installation was banned? And why is the target for full replacement set at 2050? Why are drinking water treatment plants not required to remove pharmaceutical compounds when antidepressants and synthetic hormones have been detected in finished tap water? Why does the UK have no monitoring standards for microplastics in drinking water, despite peer-reviewed evidence of their presence in human tissue and arterial plaque? Why has Britain's drinking water lead limit not been tightened to match the EU standard of 5 micrograms per litre? And why is the advisory group's recommendation from December of 2024 still not law? Why does 20% of treated drinking water leak out of the network before reaching a customer? And why does the industry consider 17% to be an acceptable target? And who is studying the cumulative health effect of chronic, low-level exposure to the chemical cocktail that British tap water now contains? These are not rhetorical questions. They are questions that every member of parliament, every water board company director, and every public health official should be required to answer, on the record, in public, under oath if necessary. This series does not simply document failure, it demands specific remedies. On Britain's drinking water, there are 7 reforms that are necessary, achievable, and overdue. 1. Statutory legal limits for PFAS in drinking water aligned with the US standard of 4 nanograms per litre, enacted within 12 months. Not guidance, law. 2. A mandatory national programme to replace all lead pipes within 15 years, funded by the water companies from operational budgets, not by 2050. 3. The UK drinking water lead limit must be tightened to 5 micrograms per litre immediately, matching the EU's revised standard. The advisory group again recommended this in December of 2024. It should already be law. 4. Mandatory pharmaceutical compound monitoring and removal at all major drinking water treatment works within 10 years. Switzerland, Sweden, and parts of Germany have already invested in advanced treatment to remove pharmaceutical residues. Britain should do the same. 5. A statutory monitoring standard for microplastics in drinking water, with enforceable limits set within 3 years. The absence of a standard is not evidence of safety. It is evidence that nobody in authority wants to know the answer. 6. A legally binding target to reduce treated water leakage to 10% by 2035, with automatic financial penalties for failure. Companies that lose 1/5 of their product before it reaches the customer are not victims of aging infrastructure. They are beneficiaries of a regulatory framework that has never required them to fix it. And 7. A mandatory requirement for food and drink manufacturers to test production water for PFAS, pharmaceutical residues, and microplastics, with results published annually, because the customer who filters their tap water but eats a sandwich, drinks squash, and feeds their child formula made with unfiltered mains water has not eliminated their exposure. They have simply been denied the information to understand it. The rivers are the crime scene, and the tap is the delivery mechanism. And the 59 million people drinking from it deserve to know what's in their glass. This is the 3rd episode in a series examining what Britain puts into its food, its water, and its people, and what it is costing us. Next week, we're going to take a look at beer and why nobody has to declare its ingredients. Please do like and subscribe and share as far as you can. The time for change is now. Thank you.